Hello, Professor, and hello, everyone. My name is Bijit from Psych 101 class, and today I'm going to present about Generalized Anxiety Disorder, known as GAD. And today content is about what is Generalized Anxiety Disorder, the symptoms, the causes, the DSM-5 criteria, statistic of GAD, treatment, and famous people that got GAD. And first of all, what is GAD? GAD is generalized anxiety disorder is characterized by excessive, exaggerated anxiety and worry about everyday life, even with no obvious reason for worry. And people with symptoms of generalized anxiety disorder tend to always expect more, can stop worrying about health, money, family, work, or school. And people with GAD is often unrealistic or out of proportion for situation. Daily life becomes a constant state of worry, fear, and dread, and eventually the anxiety so dominates the person's thinking that it interferes with daily functioning, including work, school, society, activity, and relationship. GAD is different from normal feeling of anxiousness, and it's common to feel anxious about the things happen in your life, such as your finance and everyone's in a while. And a person who got GAD may worry about uncontrollably about their finance several times per day for months, and this can happen even when there isn't a reason to worry about. And the person is often aware that there is no reason for them to worry. Sometimes people is Sometimes people with this condition just worry, but they can and unable to say what they are worried about, and they report that feeling. Sometimes bad may happen or may report that they just can't calm themselves down. And generalized anxiety disorder can present itself mentally and physically. And if you think you are suffer from this condition, you might be experiencing some of the following signs and symptoms. And these are the symptoms for generalized anxiety disorder, such as perpetual state of constant worry, inability to relax or enjoy, muscle tightness, persistent irritability, avoidance of stressful situation, hard to concentrate or focus, hard to breathe, rapid heartbeat. Sometimes you also head tremble or shake, and fatiguing easily. And what are the causes of GAD? There are four types causes of GAD. The first one is combination of genetic. It means that family history play a part in increasingly like the likelihood that a person will develop GAD, and it means that the tendency to develop GAD may pass on in families. Another one is biological factors. It means that the brain has a special chemical called neurotransmitter that send a message back and forth to control the way a person feels. And another one is temperament factor. It means that a child whose temperament is timid or shy or who avoid anything dangerous may be more prone to generalized anxiety disorder than others. And the last one is environmental factors or childhood abuse. It means that tra- uh, a traumatic experience such as a divorce in family, illness, or death in family, or major event outside of the family. And it may also trigger the onset of an anxiety disorder. And in addition, anxiety may be learned from family members and another who are noticeably stressed and anxious around a child. These are the diagnostic and statistical manual of mental disorder of generalized anxiety disorder. The first one is excessive anxiety and worry that happen more than a day for at least 6 months, and a number of events or activities like work or school performance. And that person will find difficult to control their worry, and their anxiety and worry will be associated with 3 or more of the symptoms that I've mentioned before, like irritability, muscle tightness, difficult to fall asleep, easily fatiguing, hard to concentrate, and inability to relax. And the focus of anxiety and worry is not confined to feature of an axis. First disorder example like the anxiety or worry is not about having a panic attack, being embarrassed in public, being away from home or close relative, gaining weight, or having a multiple physical complaint, or having a serious illness. And anxiety, worry do not occur exclusively during post-traumatic stress disorder. And the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important area of functioning. And the disturbance is not due to the direct physiological effect of the substance, like a drug of abuse or a medication, or a general medical condition, and does not occur exclusively during a mood disorder. And these are the statistics for GAD. While everyone can have generalized anxiety disorder, there are GAD gender differences. For example, women are twice as likely as men to have an anxiety disorder in their lifetime, and an estimate of 2.2% of adolescents had generalized anxiety disorder. An estimate of 0.9% had self-impairment. And the Diagnostic and Statistical Manual of Mental Disorder of 4 edition criteria were used to determine impairment, and the prevalence of GAD among adolescents were higher for female of 3% and for male of 1.5%. And generalized anxiety disorder cannot prevent it, but you can do something to control or lessen symptoms. They also need a therapy, like for example, cognitive behavioral therapy. This treatment involves meeting to talk with a mental health professional, and the goal is to change your thinking and behavior. And this approach has been successful in creating permanent change in many people with anxiety, and it's considered first-line treatment for anxiety disorder in people who are pregnant. And others found that the benefit of CBT have provide a long-term anxiety relief. And the therapy session, you will learn how to recognize and control your anxious thought. Your therapist will also teach you how to calm yourself when upsetting thoughts arise, and doctors often prescribe medications along with therapy to treat GAD. And another treatment for GAD is medication. If your doctor recommends a drug, they will most likely create a short-term medication plan or a long-term medication plan. The short-term medication is to relax some of the physical symptoms of anxiety, such as muscle tension and stomach cramping, and these are called anti-anxiety medications. And many people also find that daily exercise, limiting drinking your caffeine, doing some yoga or meditation, also could release the GAD. And the technique need to be taught by a trained therapist, and generally involve learning how to relax your muscle, learning how to relax your muscle quickly in a response to a trigger, practicing relaxing your muscle in a situation that make you anxious. And who also got GAD? Abraham Lincoln is American statesman and a lawyer who served as the 16th President of the United States. He was famously sober, serious in photographs and descriptions of himself, throughout history books and historical accounts. He endured many traumatic events throughout his life, uh, marked by the repeat loss of his close to him, the someone that close to him as a child. As a young child, he lost his mother, and when he turned to 18, he also lost his lovely older sister, and he also lost 10 of his 12 children to death, and he often fell down because of a lack of social upbringing and education. And these losses and his own feeling of inequality in deep anxiety throughout his life and his presidency. Historians and researchers typically agree that Lincoln must have suffered from generalized anxiety disorder based on his letters and journals, and his diagnosis would have not existed at the time, and he would have have found a way to deal with the stress and anxiety he felt as he managed the challenge of his presidency. And one more about Emma Stone. In October 2018, she opened up about her anxiety issue and her panic attack as a 7 years old. And at the time, she was at her friend's house, and all of a sudden, she was absolutely convinced that the house was on fire and it was burning down. She just sitting in her bedroom, and obviously the house wasn't on fire. But there was nothing in her that thinking that they were going to die. And soon after her panic attack, the first one, she started seeing her therapy, who diagnosed her with generalized anxiety disorder. To this day, she still has a panic attack, but seeing a therapist, meditating, and reaching out to people instead of staying as an isolated, helping her cope. And she also stated that you don't have to be an actor to get over anxiety. You don't have to be a writer to overcome it, but you just have to find what things is within you that you are drowned with. And this is the end of my presentation. Thank you for watching. Hope you enjoy it. And this also my reference for my whole presentation. Thank you.